Next up, I'll be speaking to Dr. Satoshi Minoshima, who's delivering the Henry N. Wagner Lectureship later today, titled From Molecules to the Universe. Dr. Minoshima, thank you for being here. What's going to be the focus of the plenary session?
Because of the history of almost 40 years of development, there are many molecular brain imaging technology investigated in the past, and some of them have been translated to clinical applications. If I think about for the last 10 years, most exciting development is really dementia imaging. So dementing disorders such as Alzheimer's disease, we have a little better understanding of pathophysiology and molecular pathophysiology of the disease. So along with a better understanding of the process and mechanisms, specific radio tracers such as amyloid imaging and the tau imaging, and also neuroinflammation imaging. So all of those molecular brain imaging technologies have been developed in the last 10 years, 20 years.
Would you talk about some of the most recent developments in the field of brain imaging and how patients are benefiting from these developments?
Amyloid imaging, for example, and some of the tau imaging tracers, these have been approved, and amyloid imaging has been even actually covered by CMS for reimbursement under evidence development. So I think clearly the use of those technology helping to identify patient who does have an amyloid deposition in the brain, and those patients may be treated by anti-amyloid therapy. So it's such exciting development in the last 10, 20 years.
How do you expect the field of brain imaging will change, let's say in 5 years from now?
Application, some of those brain imaging technologies, not just dementia, but also psychiatric disorders and brain tumors and epilepsy and multiple sclerosis and so on. So I think this very strong R&D or research and development is going to really open up opportunities to think about how these technologies can be applied to clinical problems we see in the modern society.